My name is Gary Painter, and I'm the director of the USC Soul Price Center for Social Innovation. And just to tell you a little bit about the Price Center, our mission is to develop ideas and illuminate strategies to improve the quality of life for people who live in low-income urban communities. And we fulfill this mission through research, student learning, and convening such as this night's discussion, which is on the Just in Reach, the region's first Pay for Success program that aims to break the cycle of homelessness and reincarceration in Los Angeles County. Now, this could be, many of you may have heard of Pay for Success or social impact bonds before. For some of you, this is a new idea that you came to learn a lot about, and we hope to really succeed on multiple fronts in terms of engaging you in terms of how this works, but then more specifically to really talk about this exciting achievement for LA County to celebrate, really what has been an achievement to kind of bring together a new approach to deal with the issues that face many of our residents here in both populations that are emerging from prison and those who are at risk of homelessness. So these models offer a new model for financing social programs. The evening's discussion is especially exciting for me because I've personally been spending the last year researching this topic and have co-authored a book that compares Pay for Success models in the UK and in the US. I have colleagues in the UK that have contributed there. And also one of my co-authors, Kimberly Bailey from the Nonprofit Finance Fund is here. Hey, Kimberly. And we're going to actually be talking tomorrow in much more detail about the book and providing that broader context of this work of Pay for Success and payment by results. Now, I understand that not everybody can join us tomorrow at noon, but if you can, we'd love to have you. For those who can't join us, yes, we will tape and video it so that you'll be able to access the information that way. For those of you who want some more in-depth, then you can certainly contact me at the Center for Social Innovation if you're more interested in this model, and we'd be happy to talk to you about it. You know, core to the Price Center's work is the pursuit of new models for social impact. And we've spent the last few months working in collaboration, for example, with the Hilton Foundation, the Home for Good Initiative, and a number of LA County stakeholders to develop the Homelessness Policy Research Institute, which seeks to coordinate collaborative approaches on research to help end homelessness in LA County. Emerging models like Pay for Success offer promising new approaches to help address this critical problem. But before I jump into the conversation that you came for tonight about Just in Reach, I'd like to introduce my dean, Jack Knott, who's the dean of the USC Price School of Public Policy, and he holds the C. Irwin and Eon L. Piper Chair, and he's also professor in the School of the Soul Price School of Public Policy. Sorry, I got a little tongue-tied there. And he's led the school since 2005. And under his leadership, the Price School really has experienced amazing and significant growth. Has strengthened its position as a leader in public affairs education worldwide. He was instrumental in securing the school's endowment, which named the school the Price School and also named the center the Price Center for Social Innovation. With that, please join me in welcoming Dean Knott to the podium. Thank you, Dad.
Thank you very much, Gary. Thank you, and good evening, everyone. I really appreciate those kind words and also highlighting some of the successes of the Price School. You know, our school's growth and rise in the national rankings is really due to the hard work of our faculty and our staff and our students, and also our research centers such as the Price Center. It also, I think, reflects our values and the effort and commitment we have put in to address some of the most complex and intractable problems facing society, including homelessness and recidivism. The gift that we got for the Soul Price Center continues to be used to advance the school's mission to improve the lives of others, whether they live here in Los Angeles or whether they live in other parts of the world. And I see the Price Center as at the forefront of this mission through developing and promoting innovative, socially innovative approaches to solve societal problems and to support and strengthen civil society as well. But of course, we don't do this at all by ourselves. We have important collaborators here at the university, but we also have very important allies and significant leaders that support us and work with us in addressing the wicked problems of our times. And no one more important than our next speaker, the chairman of the Los Angeles County Board of Supervisors, the Honorable Mark Ridley-Thomas. Mark is, please. Mark is known for his exceptional advocacy for vulnerable populations, including those who are homeless. And he is one of the foremost advocates for innovative solutions to dealing with homelessness, which is what we need. He was the architect of Measure H, the 1/4 cent sales tax, to address the crisis of homelessness that made history when it passed with 69% of the vote in March of this year. And at that time, the Los Angeles Times rightfully noted that Mark has never wavered in making homelessness a funding priority for the county. His commitment to social justice and civil rights and his leadership in civic engagement, and especially the Empowerment Congress, is also very well known. Throughout his career, he has served as an effective champion for addressing some of our toughest social problems and protecting vulnerable populations, really following the example of his heroes, Gandhi, Dorothy Day, and Martin Luther King Jr. And for a man who has stated that he never aspired to public office, I've heard him tell me that, he certainly has distinguished himself in a remarkable public service career focused on vulnerable populations. He's been a public service servant at the county, local, and state levels. He was in 1991 elected to the Los Angeles City Council. He then served in the California State Assembly and was a member of the California State Senate, after which he became the first African-American man to serve on the LA County Board of Supervisors, a very important accomplishment. In addition to being a public service, we were just talking about this prior to this meeting, Mark is a scholar. He received his PhD appropriately in social ethics from USC, so we're also proud that he is a Trojan. And throughout his career, he's really demonstrated over and over again his public-spirited, innovative, ethical, and humanitarian approach to improve the quality of life for people in their communities. Please join me in welcoming the Honorable Mark Ridley-Thomas.
Well, thank you very much, Dean Knott. I'm pleased to be here. That was a very kind introduction, and I'm sure that there is much to be shared with you tonight. I want to give a shout out to the Assemblyman from the 54th District, the Honorable Sebastian RidleyThomas. Give him a round of applause, will you? Thank you. He's in the house. And I want to say, based on your research, I'm sure you have strong insights to offer on innovations that take place within the bureaucracy. I take the point, having wrestled with the bureaucracy for more than a quarter of a century of service in public life. I think the bureaucracy simply needs to be tamed. We seek to tame the bureaucracy. We seek to demystify government. That's what my clandestine agenda is. I want to say a shout out to Dr. Painter for convening the panel as a part of your ongoing series on innovation. Why don't you give Dr. Painter a round of applause, won't you? Thanks to those who are responsible for funding from Hilton. The Center for Social Innovation is also convening the Homeless Policy Research Institute that you heard a little bit about. That's important work. And I think the Homeless Policy Research Institute will dig into these innovations within the context of Measure H and the 51 some odd strategies that have been put in place to do what has never been done to confront the menacing, the vexing problem of homelessness that stands as a radical contradiction to all the the wealth that seems to be presenting itself in the context of the city and the county of Los Angeles. Some 16 or so cranes right now stand at the corner of Wilshire and Figueroa and look all around. You see cranes everywhere. Walk 7 blocks east and you'll find yourself in utter squalor. Seems to me these contradictions abound. They will not abide. So it's at my direction that the Homeless Policy Research Institute is working with LASA, the United Way, and the CEO's Homeless Initiative to create dashboards on Measure H progress. Let me just simply say to you, results matter. It's progress that we seek. We offer not counsel of perfection. We simply seek to fulfill progress and pay for success. Then, as I prefer to call it, invest for success is an approach that I've tried to advance since the year of 2012. It was at that time that I offered a motion to study the feasibility of expanding Just in Reach, modeled through a pay for success initiative. Some of you may remember that Just in Reach model was a program piloted with the discretionary funds from my office. Support from the Corporation for Supportive Housing was also instrumental at that time. And Jack made reference to collaborations. This work doesn't happen unless there are collaborators and co-conspirators at work. Any co-conspirators in the house, you can self-identify. And so I simply want to say I've been trying since 2012 to use the Invest for Success model to accelerate Just in Reach, but it was truthfully slow going. Just in Reach finally got a boost nearly 3 years later when I regained my stamina and authored a motion to create the Office of Diversion and Reentry, and most importantly, we placed in that office, within the Department of Health Services. I think it's important that you pay close attention to what's happening in terms of how the County of Los Angeles and an anomalous form of government, executive, legislative, quasi-judicial, all in one, no mayor, no city council, all in one, and the extent to which the law enforcement presence in terms of how we manage the homeless crisis and other things are being shifted, rather than causing law enforcement to run the medical center in the jails. It is now health services that runs it. So there is a bit of a paradigmatic shift that's taking place in how policy is to unfold and implementation takes place. So from what it would have been now in the Department of Health Service, and the timing was critical. A few months later, in June of that year, we began the process of integrating the health agency itself. It is not irrelevant that the Department of Justice had showed up and said, look, you will get this in order or else. In other words, the jails in LA County find themselves in unspeakable conditions. More to the point, they said they're unconstitutional. They stand as a radical contradiction of the human rights that every human being ought to enjoy. And frankly, we ought to understand that it is a hallmark of a civil society, call it a democratic society, that people, even though they are incarcerated, are treated as human beings. It stuck in my mind when DOJ got done with their report. They said the conditions in these jails are most upsetting. There was just one line, Dean Knott, that said, if those inmates, when they went in, were not crazy. Surely, by the time they were released, they would be. Now, that's a poetic paraphrase, but I can assure you that was the thrust of what that volume sought to communicate. So in the fall of 2015, the Department of Health Services was well poised to implement the directives related countywide to jail diversion and reentry, enlightened notions of how we can manage some of our social challenges. So I also knew that the Department of Health Services Housing for Health had the infrastructure needed to provide the intensive services, locate the housing, and then ensure that the clients retained stable housing. All of these elements are fundamentally important. And so we pushed then, 2014 back there, Housing for Health had already placed some 3,500 individuals in permanent supportive housing so that we knew that they could deliver. And so some of this is about knowing, understanding, trusting those pieces of this puzzle that work. Let me just say that the work that Judge Espinosa, Kristen Ochoa, and Corrin Buchanan, they are doing a stellar job at the ODR, and we ought to give them a nice round of applause. They are ODR was smart enough to grab Corrin and cause her to move from the Housing for Health into ODR proper. She'll be here to tell you about the innovations that are occurring within that context, but it's important work. We're just trying to tame the bureaucracy. But Invest for Success is also emblematic of the innovations that are occurring every day thanks to public-private partnerships. And my wholehearted thanks, again, should be afforded to the Hilton Foundation. We tell you thank you publicly. And Andrea, we appreciate it. And we also want to thank United Healthcare for being our philanthropic partner in this venture and investing literally tens of millions of dollars. It takes resources to make this work. A lot of talk goes on, but it takes money, honey, if you want to be with me. Thank you so much. The Hilton Foundation, and Andrea in particular, they have been a key force behind the scenes, driver of the change in many contexts related to homelessness, and we need to call that out and give people their flowers while they can smell them. I want to say thanks to Measure H. We are also expanding resources for people exiting jails, including interim housing, intensive services, disability benefits, and permanent housing. And I hope this panel will highlight the challenges and the successes of expanding jail in reach. Let's use these lessons to expand the reach of many more innovative programs. It can happen right here at the Saul Price Center for Innovation here in the School of Public Policy and Planning. This is critically important work. You are a part of it. You ought to see yourselves as a part of the ground floor. Measure H is barely a year into existence. It's frankly going to pump as much as $355 million annually into services for those who are severely mentally disturbed, for those who are addicted to substance abuse, for those who are victims of the lack of affordability and the inequities in the economic environment that have caused them to not have the fulfillment in life that they deserve. And so see yourselves as a part of that. Innovation ought to have concrete implications and practical application. And to that extent, you're well on your way tonight. I thank you for this opportunity.
So I'd just like to thank again the Honorable Mark Ridley-Thomas for his work in all of this. And I believe I must take a little exception to his claim that all he's doing is taming the bureaucracy. I think it's quite evident that his leadership is causing innovation in the bureaucracy in ways that 20 years ago when I came to Los Angeles couldn't have been imagined. And so it's a really exciting time. And we're going to get to meet someone who's part of that innovation tonight, who's working in that bureaucracy. But just to give you a little background, and then I'm going to invite my panelists up. Justin Reach, in 4 years, is going to place 300 homeless individuals who are currently in custody within the county jail who have serious mental health and or substance abuse disorder into permanent supportive housing. This Justin Reach program has had a lot of folks that have worked on it, both in its earlier incarnations and also in what is now a invest for success model, or pay for success, as the field kind of knows it. How many people here in the room actually have worked on this particular project in one way or another over time? You can see a lot of hands up, So, our panelists have worked deeply into it and are going to provide an amazing context for that. So let me welcome our two leaders behind the development of Justin Reach. Andrea Iloulian, who's the Senior Program Officer for Domestic Programs at the Conrad N. Hilton Foundation, and also Corrin, Buchanan, Deputy Director of the Office of Diversion and Reentry at the Los Angeles County Department of Public Health Services. So let's please give them a hand. We printed out a couple of flyers for you tonight just to kind of give you some information and background. There's one that we put together which just says, what is Pay for Success, for those of you who have not seen it before. And you can see in this illustration, there's a lot of stuff going on in terms of actors to actually launch one of these creative programs. And I don't want to spend a lot of time talking about the details because you didn't come here to hear me give a lecture on anything. You came to learn about what's actually happening and innovations in there. But what you see is this is an incredible kind of opportunity to allow impact investors to help spur on innovative new programs in partnership with service providers, government, and most importantly, the population that is being served. And it's put together in a really creative structure that might be able to catalyze new resources to address problems or scale programs where there may not be existing county or other public resources. And so with that in background, you can kind of see how it operates. You can kind of see kind of who are the kind of key actors in that. And we've also provided some links for some of the amazing organizations that are doing work in this space, including the Nonprofit Finance Fund, who my colleague Kimberly Bailey is a member of, and like I said, we'll be talking a little bit more tomorrow. But tonight we came to kind of hear about Justin Reach, and so what I'd like to do now is perhaps just ask Corrin to talk a little bit about Justin Reach, kind of the goals of the program and how it actually is going to roll out.
Great, sure. Really happy to be here tonight to talk to you all about our Pay for Success project. And I'm especially happy to be here on the other side of the launch of this project. So we have officially launched. We launched on October 1st of this year, and it was a lot of work to get here. So I'm really happy that the fruits of our labor are now here for us to enjoy. We've actually been working on this project for many, many years, and I'm actually going to leave it to Andrea to describe some of the history because it is a long and interesting tale on how we got to be here and finally launch today, or this year in October. So I'll quickly say again who we are at the Office of Diversion and Reentry. So as Supervisor Ridley-Thomas described, we're a relatively new division within the Department of Health Services. So our division was created about 2 years ago. And our mission is to divert individuals who have a mental health or substance use disorder away from the criminal justice system and into community-based treatment. The idea that we need a different intervention to help people and to keep people out of custody settings. Something unique happened when our office was created. So the motion that Supervisor Ridley started actually said, you must use at least 40% of your funds on housing because our board believed that housing housing was so important and so integral to being able to effectively divert people away from the justice system, because we know that so many of the people who we hope to serve were also people who are experiencing homelessness. So that has really been a cornerstone of the work that we're doing at the Office of Diversion and Reentry. This project has been, and I'll probably talk about it more as we move through the program, but a real example of a collaborative effort. So our office and all of the work that we do, and in particular in this Pay for Success project, has been a true collaboration with our partners at the Sheriff's Department, our partners in the court system, our partners in the probation department, our departments in the Department of Mental Health, and in the substance use treatment world. We really have brought a lot of new players to the table to start to think about how to do something different in this problem that has been seen as intractable, but what I think we are proving day in and day out is actually has a true and relatively straightforward solution, which is housing connected to services. The intervention, Gary mentioned, it's a housing intervention, so we're identifying people who are currently in custody, and what we're doing is we're diverting those individuals, we're taking them into a specialized court where we are able to settle cases. So there are people who are facing felony charges who, in some cases in lieu of what could be a lengthy prison sentence, are being connected to permanent supportive housing and mental health services. So it's a pretty inspiring program to be a part of. I'll also say that we're doing this as Supervisor Ridley-Thomas described, building off of an existing model that the county had created called Housing for Health, and that was a permanent supportive housing intervention that had been really targeted at frequent users of our healthcare delivery system, so otherwise known as frequent flyers in our emergency rooms. So what we did is we took the same intervention that had been successful for us to help people who had been in and out of our hospitals, instead move into housing and stop that hospital use. We decided we would try the same intervention for people who were in and out of our prisons and jails, and try to see if we could end homelessness and reduce their recidivism in that system. And as we've started to do this work and deliver these services, what we have come to discover is that it's really often many of the same people who are just ricocheting between these two systems. And so the intervention, we believe, will be really successful, both in ending homelessness and reducing recidivism for this population. So I think I will leave it at that and turn it over to you, Andrea.
That's great. Yeah, thank you. Thank you so much to Gary and everyone for being here today. It's really exciting to talk about this project. Like Corrin said, it is amazing to be on the other side. I started working at the Conrad N Hilton Foundation in 2010, and that was when I first learned about the Jail in Reach program. So it gives you a sense that from the very beginning, this is something that we've sort of been working on from the foundation's end or interested in. The Conrad N Hilton Foundation is actually a global foundation. We fund globally. We have 6 major strategic initiatives that are global or international, and our smallest geographic strategy is actually our strategy to end chronic homelessness in Los Angeles County. And the foundation's been working on ending homelessness for individuals with severe mental illness diagnoses for more than 25 years. And we were actually one of the original funders when permanent supportive housing and housing first and harm reduction, which are the premises on which the permanent supportive housing today works on. We were some of the original funders in New York when those interventions were first emerging. So the foundation's had a long commitment to funding evaluation and pilot projects and sort of determining how to best implement this intervention, and the fact that permanent supportive housing is the solution to chronic homelessness. In 2008, the Foundation's Board of Directors decided to narrow the focus of our work on homelessness just to LA County. And so since then, we've sort of had more of a targeted effort here, and it has allowed for an evolution of a lot of really intense public-private partnerships, and this is one of them. And Corrin mentioned before the Housing for Health program, and which is a key element of it is the flexible housing subsidy pool, which is the funding mechanism with which the county pays for many of these housing vouchers. And you'll see on your table, there's actually a document about the pool, a summary about the flexible housing subsidy pool. And the Hilton Foundation was actually one of the major investors in helping to jumpstart the pool. So this Pay for Success initiative actually builds upon a really deep relationship that we have built with the Department of Health Services and the Department of Mental Health and the Sheriff's Department for many years. But I will go back and talk a little bit about the idea of when this Pay for Success idea emerged. the supervisor gave a he gave a couple of the points I have here, which was really interesting that we all remember these moments. So the Just in Reach program, the first pilot of it was actually primarily funded through the Corporation for Supportive Housing here by the Robert Wood Johnson Foundation. That was the major philanthropic funder of that effort. And the Hilton Foundation learned about the effort and got interested in it and was funding it indirectly through CSH, but hadn't really directly invested in the program robustly. But in November of 2012, when Supervisor Ridley-Thomas filed the motion that potentially the Jail in Reach program could be a pay-for-success project, the Hilton Foundation put a proposal in front of our board that ended up providing $1.5 million over 2 years to run a pilot of the program, including an evaluation that would help determine whether or not it would be a feasible program for pay-for-success. So more or less, we've been working on this since 2012 in a very intensive way. And so we've been sort of following the effort ever since, and following the evolution. The supervisor did share that there was that original motion, but then there was a follow-up motion that actually the county wanted to have a blueprint for what pay for success would look like in the county, and then open up an RFP process for programs to apply. So after a lot of work with the county on trying to get pay for Just in Reach to be the project, we ended up having to go back and do an entire application process after they created a blueprint. So there was a lot of waiting and patience, but with a lot of hard work. Particularly, I will give a lot of credit to the team at the Corporation for Supportive Housing for sort of continuing to spearhead the effort. I think I'll just speak one of my favorite talking points about what's essential and effective funding from a philanthropic perspective is fully funding your intermediaries to help do this sort of work. And so we're really happy with the wonderful work that CSH did to sort of help make this happen. And so I'll just share one point about the timetable of this. Something really interesting that the Hilton Foundation's board actually did on this Pay for Success deal that I haven't heard of many other foundations actually doing is they committed the money before the deal was done. So the Hilton Foundation board agreed to commit $3 million to this Pay for Success deal with fairly broad potential terms, and then left it to the staff to go out and help find out another funder and negotiate the deal and come back with final terms. And so that was something that was a little bit unique, and we were really grateful that our board felt that much confidence in the program and in the staff to allow us to do it in that way.
And we were really grateful to have a funder who was willing to work with us while we were really sort of hashing out the final terms of the agreement. So we have two really spectacular funders for our project here in LA County. The first being the Hilton Foundation that came in at $3 million to support our program over the 4-year term. And then the second being United Healthcare, a national managed care organization that was really interested in doing a Pay for Success project in the healthcare space. They weren't sort of new to the criminal justice space, but they felt like this was a great way to have an impact on a really vulnerable population with complex health conditions. And so they came in as our senior lender at $7 million over the 4-year term. So, but we couldn't have made it across the finish line without Hilton Foundation jumping in first and sort of testing out, showing others that testing the waters and that the pool felt good and others should come in and join us. So we were incredibly thankful for their support.
So for our audience, this is somewhat mundane, but I think both of you alluded to the joy of being on the other side, and we'll come back to that in a moment. But just who are all the actors? So as we have a picture of who are the investors, who you just mentioned, intermediary service providers, independent evaluators, the government agency, just kind of outline for the audience who are playing these different roles in this Pay for Success contract.
Mm-hmm. Yeah, I'll take a stab at that. So the government and end payer is the Department of Health Services through the Office of Diversion and Reentry. So I represent the end payer if the program is successful. And I alluded to this before, but we have two outcome metrics that we have selected for this program. And they are, while simple, very meaningful metrics for us. And the first is, are we able to end homelessness? And we look at that by looking at 6 and 12-month housing retention rates, which is the national standard in the world of ending homelessness to measure success in our efforts. And then the second is recidivism. So we will look at returns to custody over the term of the program, and success payments will be based on reductions in recidivism. So we'll be making those payments. We have an intermediary, and that is CSH. We have a wonderful intermediary, and they sort of sit between the end payer, the government, and our investors. And then we also, of course, have our service provider partners. And our Pay for Success project is actually a little bit unique because in this scenario, the Department of Health Services actually holds the contracts with the service providers. In many other Pay for Success projects, the intermediary holds the contracts with the service provider. We decided to have the Department of Health Services hold the contracts for a couple of reasons. One is that we had a set of a sort of a cadre of effective providers who'd been able to demonstrate some success in serving people who are those frequent users of the healthcare delivery system, those frequent flyers in the ER. And most importantly, because the Department of Health Services operates the flexible housing subsidy pool, as Andrea mentioned. And that was really key to our success in being able to provide housing to these individuals. The flexible housing subsidy pool, kind of a mouthful, is our locally funded rental subsidy program. So it really is it's sort of the magic key for us to be able to find housing for these clients. So the clients that we're serving through the Just and Reach Pay for Success project will be connected to housing, either scattered site housing or project-based housing across Los Angeles County, which means housing that we find out on the market or in developments that are operated by, in most cases, nonprofit supportive housing providers. So the flexible housing subsidy pool is important because it does not have exclusionary criteria related to justice backgrounds, which has historically been one of the challenges that we have faced as we try to connect our clients to rental vouchers. But thankfully, I think if folks don't already know, and you may not have heard, but there are both of our housing authorities here in Los Angeles County have recently made the right move to reduce some of those barriers that clients may face in accessing rental subsidies. And it's a move in the right direction. It's a move into the sort of the philosophical approach of housing as a human right and something that everyone should have access to despite of their background. But there are still some exclusionary criteria that are set at the federal level. And so our rental subsidy has that flexibility that the federal vouchers do not. And we're living in a time where we have really uncertain access to federal housing resources. And so having a local rental subsidy is really important in this particular climate. So our service provider partners are what we call intensive case management providers, and then our flexible housing subsidy pool provider, Brilliant Corners. And I'll just end by saying that I think as we talked to people about our sort of untraditional Pay for Success model, where the county actually both held the service contracts and was the end payer, we felt it out with others sort of in the field, and we said, does this make sense? And we actually discovered that there were some real benefits to having the county actually hold the contracts with the service providers rather than the intermediary. And one of those benefits is that if the program is in fact successful, it's easier for the county to take on the work in an ongoing way because we are actually already holding the contracts with those providers.
And so what I want to do now is just kind of put a bow on what is the Pay for Success model and the promise in this context. Because as you kind of heard, you've heard investors, you've heard end payers, you've heard intermediaries, and so forth. And what's the promise of Pay for Success that gets a lot of people excited, and for those of you who are new to Pay for Success, is that the government as an end payer actually doesn't actually pay for the program up front and only pays if it does deliver in essentially saving the government money in one way or another. And so identified in this program is particular streams where there is a lot of expense in the criminal justice system and in the Department of Health Services. Right? And so that's really where the promise of Pay for Success comes from. But in order to catalyze that promise, you do need impact investors up front who are willing to front the cost to deliver this potentially innovative program that will transform potentially a particular issue area and so forth. In this case, there's some exciting and uniqueness because it's really addressing two issues that often face and are very high cost to government with respect to recidivism and also mental health services and homelessness. So actually that would be 3. And so in that context, and we'll kind of open up for questions in just a little bit, but that's kind of completes the circle. So the promise is you don't have to pay as government until it's successful. And then the investor gets a graduated return depending on how successful it is, right? And so there's an expected return and so forth. So that's kind of the excitement behind it. As what I'm going to ask you now is you did mention that you're really happy to be on the other side. And given that it took some time to get to the other side, what are the kind of lessons learned or challenges to get to that point where you're able to line up the contract and line up all of these relationships that were necessary to be successful?
So I would say that one is, which we've heard from several communities that have successfully closed deals, is having, from the investor side, having a local funder invested in the program has been really helpful, particularly one who's willing to sort of be interested at the beginning and then continue to get out there and say, yes, we're still interested, we're still interested. It turned out to also be, we had heard that would be helpful, so for us that was a helpful sell to to our leadership, that was a good idea for us to get out in front and put the money on the table really early. But one of the other great lessons that we learned was that when it came to setting the success metrics and when it came to talking to other investors about the flexible housing subsidy pool, housing for health, the incredible housing success rates that they have already achieved, and setting some of the success metrics and some of the other parameters became a little bit easier because one of the investors at the table already had the full context. And so what it did was it created a really great relationship. I think it also helped that we only had 2 funders. Made it a lot easier. So thank you to United Healthcare for covering the rest of the deal. But it was very helpful in creating a great dynamic between the foundation and United in that, they had worked on other deals before. So, and this was our first local, we've done an international sort of similar deal, but our first domestic deal like this. So they were really helpful in that way. And we were really helpful in answering their questions about the context of the deal, why we felt so confident, why we felt this was such a great investment, providing some insight on the housing metrics, particularly the housing retention metrics. Really? They really can hit that metric? And we're like, yes, absolutely. Absolutely, they can hit that metric. We feel confident in that because of our deep relationship with the program and the results we've seen so far from our other investments. I think that's one of them. Mm-hmm. Be patient with yourself. If you're going to do this, be patient with yourself. Find a patient intermediary partner that'll walk you through it. When this started, I could have explained to you how Pay for Success worked, who you needed at the table, why it was a potentially beneficial performance-based contracting sort of opportunity, financial opportunity. But when we got to actually discussing how the success payments work in relation to the metrics, in relation to it is complicated. So just if you decide to pursue this in any way or continue to study it or look into it, be patient with yourself. It is incredibly complicated, but I promise you will one day understand that financial model that comes in a crazy Excel spreadsheet. You will one day understand that. I don't know if there's other.
So perhaps an obvious question is, you mentioned performance contracting, and there could be a whole slew of different kinds of approaches with performance contracting that could have been enacted. But this approach to take a program that had piloted a little bit with enough success that you were feeling confident about it and to scale it up, you chose to do this as a pay-for-success contract as opposed to a different kind of contract. So what do both of you view from an investor side and also from a county side as really the promise and possibility that you might be able to achieve because it's a pay-for-success contract, which you may not have been able to achieve if you had followed a different approach to try to scale up a potentially promising pilot program?
I will just say, I think the orientation that I personally in my office has taken is the orientation that sort of everyone who cares about Pay for Success wants to see happen, and that is a move towards paying for outcomes rather than outputs. So certainly we had to do in this process, this iterative process of designing a financial model and going back and forth with our investors on our metrics and the payment structure that we would eventually bake into this 100-page contract really helped us to think about the outcomes that we were hoping to gain out of a project like this. And, I think that our department typically tries our best to be focused on outcomes, but this really forced us to do some of the deep thinking about what it was we were hoping to get out of a project like this. And we also had an opportunity through this project. I'm calling it opportunity now. It was the bane of my existence for a number of months, but we had to look at a lot of data, both local and national data, to inform both the design of the intervention and the way that we set up the success metrics. And so we did a couple of interesting things. We were trying to understand what type of outcomes we could expect in terms of both housing retention and recidivism for people who are connected to permanent supportive housing who have these histories of incarceration and homelessness. And we were able to create sort of a unique evaluation design. We looked at local data for people who we knew by looking at service utilization data had touched our justice system in the past, and that we also knew by looking at LAHSA data, our Los Angeles Homeless Services Authority data, had also, and I'm waving at my LAHSA friends in the back, that they had also gotten access to permanent supportive housing, and we could make sort of a base case argument about what kind of outcomes we thought we could have on particularly recidivism for that population. So it was kind of a fun opportunity to dive into some local data, and then we also drew upon national data as well about the types of outcomes we could expect to see. So that was I think a great outcome of the project. And then I'll just quickly say the other great thing that comes along when you do a pay-for-success evaluation, a pay-for-success project, is that the opportunity to do an evaluation is baked into the deal, because you have to have an outside entity that'll validate your outcomes. And our principal investigator, Dr. Sarah Hunter from the RAND Corporation, is actually here tonight. Hi. Dr. Hunter. And so we are really thankful to have Dr. Hunter and her team as our evaluator for this Pay for Success project. So this is just allows us an additional opportunity in the funding, which is built into the Pay for Success model, which means the capital to fund this evaluation is actually a part of what the Hilton and the United dollars are going to be used for, will help us understand what kind of outcomes we're going to see from this work and understand some long-term impacts of the intervention.
So Hilton could have actually funded the scale up directly, potentially, right? Yeah. So why partner in this way? What do you view as the opportunity to catalyze work in different ways? Like what are the things that Hilton thought about to catalyze a pay for success contract rather than just kind of fund a Just and Reach program directly?
Yeah. Well, so the first Housing for Health program, which helped build the flexible housing subsidy pool, we actually just put $4 million into as grant money. And then there was a partnership with the probation department called Breaking Barriers. We just put $2 million in as grant money to make that deal happen. With this opportunity, when we first started having this conversation in 2013, there had not been very many Pay for Success deals that had closed. So it was sort of this idea that this would be a great model for this. And so we got a little attached to it. I'll be very honest. We got a little attached to the idea. But inevitably what happened was, United Healthcare historically wasn't an investor here in Los Angeles. And actually, when we had the meeting with other investors, there were, equity companies that are, firms that are bringing together equity to invest in Pay for Success, and banks and other people that were interested in financing this, who I think that money that the local philanthropic dollars, that our philanthropic dollars could catalyze is $7 million that I don't think we would have necessarily been able to acquire in that sort of way. So I think it's a little bit of it is the scale, as well as the access to the HUD DOJ and the state criminal justice funding. Those were other appealing aspects. So as the pieces sort of fell into place, there were definitely several moments along the long road where we said, well, maybe it won't happen. And I will say, Corrin and her team, I give them a lot of credit. It was when the Office of Diversion, just as the supervisor said, it was when the Office of Diversion and Reentry formed that we finally saw, we were like, this is really going to happen. We're really going to make this happen. So, I think it's an opportunity. I think it goes all the way back to this idea that if you're going to do philanthropic funding and true public-private partnership, you have to work closely with your public partners to determine great ways to make great things happen. And sometimes it's going to be a grant. Sometimes it's going to be a straight PRI, program-related investment loan. Sometimes it's going to be an investment in a pay-for-success model like this. It's potentially going to always be different. But if you want to be if you're able to be a nimble, creative, philanthropic partner, it should really be about what gets you the most leverage. And in this circumstance, there was a great opportunity to make this program happen by making it a pay-for-success project.
I'll just add one more thing. I think so. We, after we sort of moving along the feasibility stage and we're moving into the program design stage, I actually had the opportunity to make this pitch, sort of why pay for success, to a number of parties, in particular to our Board of Supervisors. And we actually have a Justice Deputy here tonight, Dana Garcetti, and she was one of the people who I had to convince that this was a good investment of our local tax dollars. And as Andrea mentioned, we were able to draw down both federal and state funding to help support this project. And I think those types of funding are really useful because Pay for Success is still a new initiative. And so we had to invest significantly in building out this financial model, and we had to invest pretty significantly in designing the model. And the hope is that eventually, as Pay for Success becomes more common, those things will be a little bit more something you can just take off the shelf, and you won't have to build them from scratch again. But we needed that money to help us do all of the early stages of the work. If we didn't have that money, it would have been harder for us to get there. But the ability to try out an intervention with zero risk to the county was certainly appealing to some of our electeds. The fact that we would be focused on outcomes and that our contracting would be designed with that in mind as well was also very appealing.
That's great. So I have some more questions, but I have a sense in the audience that probably many of you have questions as well. And so let's go ahead and open it up to questions for our panelists about Justin Reach.
I'd walk away right there. What are the expectations of the inmate once they're released and accepted into the program, and the outcomes for sustainable permanent housing?
That's a great question. So the intervention provides you get sort of a set of resources. When someone is identified for the program, they're currently in custody, as I mentioned, and then we connect when they're released. We do what's called a coordinated release, and this is incredibly important because if we don't have a service provider at the exit to the jail when someone leaves, we're much more likely to lose that person to follow up. So we do a coordinated release that we organize with the Sheriff's Department. And then our client is then immediately placed into an interim housing site. And these are actually JWCH runs a couple of our amazing interim housing sites. And so we connect clients to interim housing, and these are settings for people to stay before they move on into their permanent supportive housing unit. They are really warm and welcoming sites with intensive case management, really intensive case management and supportive services on site. And then a client also is connected to a case manager that's their case manager throughout the entire process. So while they're in interim housing, while they're in custody still, while they're in interim housing, and then on into permanent supportive housing. People stay in interim housing between 3 and 9 months and then move on to their own apartment in the community. And as I mentioned, we launched the program in October, and we now have over 25 individuals who have already moved into their own permanent supportive housing, their own apartments. And they have a lease for their apartment that they, and our clients are responsible for paying 30% of their income towards rent. But they have the same rights and responsibilities that any of us would have if we rented an apartment. The case management is really, really important. What we've discovered is that you can provide sort of case management till you're blue in the face, but if you don't have a rental subsidy, you're not gonna end homelessness. And if you just have the keys to the apartment but no services, our retention rates are not so great. So we've got to combine the two, and we've been really successful with this model at the Department of Health Services. Supervisor Ridley-Thomas mentioned that we've now provided housing to over 3,500 individuals across Los Angeles County with a 96% 12-month housing retention rate, which we're really, really proud of, and as a testament to our service provider partners, well above the national average, which is often sometimes around sort of high 80s, low 90s. So we're doing really well in LA County because we've just got this incredible cadre of providers out there. So in terms of the what a client has to do, these are voluntary services, and the role of our case manager is to help clients get connected to mental health services and substance use treatment. So we try our best to help clients get connected to those services, and oftentimes that means resolving their ambivalence about accessing these resources, and just being there along the way and helping them to design their own client-driven goals.
Hi, thank you all for the information. I just had I guess a clarifying point.
Introduce yourself when you're...
Oh yeah, hi. I'm Ben Henwood here at the Suzanne Dvorak Peck School of Social Work. So my question, I guess, is just, and maybe I missed this, but so is United Healthcare expecting to get their $7 million back if you hit your targets, and is that what the county will pay them? Is that how that works?
Yeah, the county will pay if 100% of success is met, then both of our investors will get their investment back plus interest. Yeah. So if 80% of success is met, they get 80% of it back. It's not there's no cliff there. You get the level of success that you get, the greater your return on you get your principal and your interest at that point.
Hi, Nicole Fiore, Apt Associates. Corrin, I wonder if you could talk a little bit about before the housing intervention starts, when the person is in custody, what is the eligibility criteria for someone to ODR to flag this person that says, okay, this person might be a good fit for this program, and what does the specialized court look like?
Yeah, it's a great question from a researcher. So the way that basically to be into this program, you have to meet some eligibility criteria. So you have to be currently in custody. We are looking for people who are homeless, and we are looking for people who have a complex mental health or substance use disorder. And the clients are identified from a variety of different referral streams, but the bulk of the referrals are through jail-based clinicians. So I keep referencing Supervisor Ridley-Thomas, but he brought up a lot of great points, and one was that the delivery of healthcare services in the jail was recently became the responsibility of the Department of Health Services. And that is really key to the success of this program, because it's actually our own clinicians. So my colleagues are now delivering healthcare and mental health services, and most importantly, brand new, now doing really significant substance use treatment services in custody as well, things we've never really seen before. So they are identifying clients and able to use clinical discretion to refer those who, and we tell them, send us your most complex clients. We want the people who won't get access to these services otherwise. And our providers are telling us, yes, you are picking the people who are hardest to serve. You're doing it well.
My name is Adrian. I also work at the Weingart Center, and I happen to be the program manager for Housing for Health interim housing program who receives ODRs. And my question is kind of piggybacking as you select these candidates. Anybody work with them prior to them being released? Is there a certain amount of time that they have to work with somebody to prepare them for going into interim housing before they're linked up with an ICMS provider?
So no. So one of the hallmarks of our program is that we like to say yes, and we don't like to say no. So a lot of programs that have been implemented in the jail or in other settings say you must have this particular mental health condition, or you must have been, have still 90 days left on your sentence. And they've sort of picked and created these sort of narrow criteria. And those criteria have oftentimes actually gotten in our way of being able to serve the people who we hope to get into the program. And so we have quite explicitly and intentionally tried to make the criteria as broad as possible to ensure that flexibility. eligibility. And I know that it does oftentimes make the job harder for our service provider partners because it could be that someone has only met 1 or 2 times before they're released with their case manager. And so that means there's more support and guidance that needs to happen once someone is released to help them understand what the program entails and to begin to develop care plans for that person. So we're not making it easier on you guys, but it means we're able to really serve the people who need the resource the most.
Good evening, Maurice Hudson. I teach in the School of Social Work, and I absolutely love everything that I'm hearing about this, but I have a concern that is starting to bug me, which is some of the research we look at tells us that contact with the criminal justice system, particularly for young black men, does not bode well for their future. And if we've got folks, I was just doing office hours with one of our students who's in a placement on Skid Row, and he was so demoralized. I wish I could have dragged him here with me. He would be so uplifted by this. But he was so demoralized by the intractability of the problems that he was seeing in his placement. And what's occurring for me now, though, is there might be some sort of perverse incentive to want a particular person to actually have a criminal justice contact so that they could access services that they might not otherwise be able to access. I'm wondering if you could address that.
I am so glad you asked that, because now I get to talk about my second favorite project, which is not a Pay for Success project, but which is the Law Enforcement Assisted Diversion Program, which we just launched in LA County. It's a model out of Seattle to try to keep people from ever even entering the justice system in the first place. So we launched the program. It's in Long Beach and Compton, and it's along Long Beach Boulevard. And the idea is that we work with law enforcement, working with both with the LA County Sheriff's Department and with the Long Beach Police Department and the DA and the Long Beach City Prosecutor to work with law enforcement to divert individuals who would be charged with felonies and misdemeanors. They're mostly drug-related and prostitution charges. There's a set of charges that could, in lieu of arrest, the individuals can be connected to intensive case management and housing. So it's a very similar intervention, but it happens earlier on in what we call the sequential intercept model, and the places at which someone who has a mental illness might come into contact with the justice system. And so we've got to do work on the front end as well to keep people out of the justice system in the first place. And it's especially important for addressing racial disproportionality. So the model out of Seattle was actually in response to a lawsuit around racial disproportionality in their justice system.
The other thing that Corrin spoke about earlier is the fact that many of the clients that they're finding in the jail in Reach program are the same clients that they're finding in the DHS connected hospitals. And so if you only knew about the jail in Reach program, I could see that would be that could be a concern. But the idea is that the department, these individuals cycle. It's a cycle from street to hospital to, the jail system and back around and around. And so it's what the Department of Health Services is really trying to do is make sure that there is an entry point to permanent housing all those places. So there are really intensive, street outreach teams, particularly in the Skid Row area. There are individuals who are frequent users of the Department of Health Services can access the housing through that connection or through the criminal justice system. So they're putting it out in all the places. So it's really, if you have that high acuity and you're connected with one of these county services, then you'll be connected to the housing intervention. That's the goal, right?
Yeah, thank you. That was a perfect explanation. She should be our spokesperson.
Hi, I'm James Thomas. My question is there a way to reconnect folks to their families? Because most of the folks and the client base that you're referring to, they have families that they are disconnected from. And so I would imagine that a part of that healing process in terms of sustainability is to make sure that the family is on the same page in terms of helping the health and the well-being of this person. And so is there a strategy that is being utilized to try to reconnect folks?
Yeah, absolutely. So one of the goals of our intensive case management service model is family reunification. So working with clients to reconnect with loved ones in Los Angeles or elsewhere. We get asked about that a lot, particularly just frankly from like a cost savings perspective also. We say, you could have better outcomes, and you would save public dollars when you can connect someone back with their loved ones. So certainly there's incentive to do so for the well-being of our clients, especially.
Hi, I'm Katie Clark, and I'm with the California Policy Lab at UCLA. My question is, how did you think through your research design for evaluation? Like, I'm just curious, who would your control group be? What would they look like? Or do you even have a control group? How are you thinking through those challenges?
Dr. Hunter, do you want to say anything here?
Really great question. Well, for the so there's two parts to the evaluation. So for the success payments, there's not a comparison group involved. It's just an evaluation of the participants in the program and their success in terms of housing stability and recidivism. But we also are fortunate enough to have funding to look at longer-term impacts. And so we're using an observational comparison group using data from LA County. The Enterprise Linkages Program, operated and managed by the CEO's office, allows us to identify people who look similar to the participants but are not enrolled in the program and use them as a comparison group to look over time. Are we seeing changes in not only their criminal justice outcomes and housing stability, but we could also look at their healthcare utilization, use of substance abuse treatment services, access to general relief, the cash subsidy. So we can look more broadly at their utilization and associated costs to LA County.
Andy Perry, CSH. So I guess if there is a group of people who look like the treatment group, why not, A, why aren't they getting included, but also B, why not have an RCT model? Is that...
And for our audience, you might define some of those terms.
So RCT is a randomized controlled trial, which is, taking people who are eligible for the program and, like, by a flip of a coin, assigning them either to get the program or not get the program. And we, that wasn't really our decision. That was part of the whole program planning process. There actually is a lot more costs associated with doing an RCT because you have to work to identify twice as many people and monitor them over time. And so it was determined not feasible during the program planning process, and that this would be a much more feasible approach to look at impact.
Yeah, we, because again, we like to be the program that says yes and not the program that says no. It felt we weren't able to flip a coin to help these individuals access services because we were prioritizing the people who need them the most. It became challenging for us to make that decision, so we decided not to do it this time.
Question?
Good evening, Maria Calix, Commission for Women, LA County. And under the commission, we also have committees, and one of them is the health committee, which I chair, and we're looking at areas of improving things. Obviously, one of the things before was the data, the accuracy of the data and the sources of data. I'm glad to hear that you're looking into the mental health issue, and that's also what we're looking at as far as homelessness. And this is in relationship to women and girls, right? And so just wondering if you have I can drill down on your data, what you have available into the demographics of the females, right? So is that something that, because, you have so many sources that you can go to, but I don't want to duplicate either, and where the commission can be of help. To your department as well.
Yeah, we rely a lot on the Enterprise Linkage Project that Dr. Hunter mentioned at our Chief Executive Office. And we particularly go to it for data related to service utilization for mental health services and substance use treatment and physical health services. So that's sort of our go-to place to find, to understand the population that we're hoping to serve in our programs.
And are you familiar with the report that comes out? The commission is paying an outside entity like Mount St. Mary's to help us gather some data, which they also, part of it they get from the county, but they cannot get everything from the county. So are you familiar with that report?
Yes.
Okay, great.
Yeah. Thank you for your work.
Our efforts is to eventually have it come out of county itself, right? And so, but the homelessness issues is one of the tentacles that we're addressing for the next few months, and so want to be able to marry the two, so that maybe invite you over, or someone you designate to our committee meeting, whereby we're addressing that and see where we can collaborate as well.
Yeah, absolutely. I'll also just mention that when we started the project, we had originally planned on just focusing on one jail called Twin Towers, which is almost entirely just a men's jail. It's the mental health facility in LA County, but we made the decision, although it added some administrative complications to the project, to work at more than one jail. We decided it was worth it because we wanted to be able to include the women's jail as well. So our program serves both men and women.
I'm Yolanda Arias from the Legal Aid Foundation of Los Angeles. We provide free legal services to individuals, frequently homeless individuals, things like removing barriers to employment due to criminal records, housing, benefits, advocacy. And I was wondering about your nonprofit service providers and whether the compensation to them also depends on achieving the outcomes. And if you find that nonprofits are having problems coming up with the capital up front, and can afford to wait for the outcomes to be achieved before they get funding.
So we do provide upfront funding to our provider partners because that also just wasn't something that was feasible for them to wait until success was achieved. Yeah.
And Corrin wouldn't brag about this on her own, but we hear very often from the providers that we fund that they love their contracts with the Department of Health Services because they feel that the level at which they pay is a level at which they operate. And so I think that the Department of Health Services has set some new bars about what it really looks like to fund full services. And a lot of the provider community, they're very happy with their contracts and their partnership. So
we say if we're going to ask our providers to really live sort of a whatever it takes approach to helping some of our clients with really complex issues, then we also need to be a sort of a whatever it takes funder, and we need to be able to provide, in some cases, flexible funding for things like accommodations to a unit, or to pay for sometimes it's things like durable medical equipment or emergency apartment cleaning, things like that. Those are the types of things that we try to find a way to figure out how to fund. And we've been able to do that because we have a flexible housing subsidy pool. It's this very flexible mechanism for being able to be responsive to our clients.
Hi, Faith Washburn, Epi Analyst at Los Angeles County Department of Public Health. I was just curious, I know that with permanent supportive housing for high utilizers of DHS services, you use a mixture of both project-based housing and scatter site housing, but for this, do you find that one method works better than another? Is there a certain one that you prefer?
I wish that there were more project-based housing. I'm looking at my LASA friends. We all wish there was more project-based housing out there. It's been something that we really need. But we just also have to rely on scattered site housing as well. We need to really focus on increasing the number of new permanent supportive housing developments that we can develop here in LA County. And I'll just say a little bit more about that. We have discovered that having on-site supportive services and a regular, the friendly face of a case manager on-site makes a huge difference. We also oftentimes are able then to co-locate mental health services, substance use treatment, and in some cases physical health services on-site in our supportive housing projects as well. When we do scattered site housing, it means that our providers have to deliver, they're sort of driving all over town to come to the home of our client to visit them in their home. And that, I think everyone here probably knows a thing or two about LA traffic. It can be really tough. So.
I had a question about what is the total, do you have a sense of how many people in the county actually could benefit from this, and then how many you're actually having the capacity out of that to work with at this point in time?
So on any given day or night, there are around 17,000 individuals who are in custody in LA County. We have a massive jail system. And the number of people with a mental illness in our jail system, we are seeing an upward trend in that number. It's been rising now for quite some time. And so the latest numbers that I saw were over 4,000 individuals on any given day are incarcerated and have a mental illness. These numbers should shock us into action. These are, we have a lot of work to do. And we'll continue to try to fight to expand our program to be able to reach more people. And, you know, having opportunities to scale our work through Pay for Success is one of the avenues that we've been able to do to get there. Lots more work to do.
Eob Tesema here. My question goes to try and touch upon performance and evaluation. We've heard a lot about philanthropic efforts to invest with the public-private partnership, and it's fine and dandy to actually dole out 7 million, 10 million, and have 100% success rate with interest to boot, for investors to get their money's worth. What I have not heard is the flip side of reality, which basically talks about complete failures. And I don't know if it's too young and too new to actually have seen the other side of success, which is failure. But I'm curious to find out, as far as performance of these contracts and the contract providers, what if they don't perform up to expectations? What happens if they fall far below expectations? And is there any kind of contingency or fallback position to basically address those issues as they come up and you don't see a return for your investment?
So I'm going to let Corrin speak to the success payment on the back end and what happens on the failure end. But I want to share, so first of all, the one thing we didn't talk about is the way that the capital stack usually works in these pay for success investments. Usually there's a philanthropic funder that takes the higher risk. So half of our loan is zero interest. So actually what we did was primarily put the money up so that a funder that potentially was going to invest money from a different source where they are looking for, some foundations use money from their endowment as opposed to money from their payout, and on those dollars, they're looking for an actual return. So a lot of the Hilton Foundation actually put in that the lower interest capital investment in order to incentivize other funders to join the table. I'll also share that the Just and Reach program had 2 iterations that were both funded that were successful, but there were definite flaws. In the second iteration that the Hilton Foundation funded, there was actually an improvement group that was put together that met for several months to figure out what was wrong and how to fix it. And there were still flaws in the program, even in the program that was funded in the second iteration. And because there had been 2 iterations and pilots of this program that had been funded, it gave us even more confidence in knowing that we could do it this way in the Pay for Success on the third end and sort of have a good sense of whether success was going to be met. And Corrin actually mentioned earlier, one of the biggest challenges in the first 2 iterations was making that coordinated release and making sure that someone was there when the inmate was released. And so there was that's one example. So there were some failures along the way. There were some missteps and challenges. And so we definitely invested in that end as well. We're excited to be investing in this end as well. We think there'll be success.
I'll just say that in response to the needs of our funders around risk, we set up a set of scenarios in which our investors could pull out. So one of those was if we don't see any move-ins, if we don't see enough people coming into the people, referrals streaming into the program, and then people getting served, we've got about a 6-month window when we can just pull our money and call it a day. So I'm happy to say that we have, for the month of October and for the month of November, we met our benchmarks for move-in. So I think our investors are hopefully feeling, one of them is here tonight, I think she's feeling pretty confident that we're going to make it through that 6-month window. But certainly that's one way in which our investors.
Will you speak a little bit to what it looks like from the provider perspective if success is not just achieved?
Yeah, so we also built into our contract a mechanism and a very regular mechanism for sharing information on provider-based performance with our investors. So every quarter we have to provide Jessica and I are working on this as we speak, a hefty set of data points related to outcomes by provider. And if we have a provider that's underperforming, we have a set of steps that we would take to address those issues. The last step being to move those clients to another provider.
But the provider still gets paid.
Mm-hmm.
Yeah, the providers get paid. I think that's a question a lot of people have. Well, do the provider, yes, in this scenario, the provider...
For any services they deliver, they get paid.
Yeah, for any services the provider delivers, they get paid.
But I think it's worth reflecting on that question, just for the broad issue of how do we ever develop new ideas that could be transformative in our social sector work? Because if all we are is so risk averse that we're afraid to do something until we know it's going to work, right, then there's no risk in taking it, and then we kind of deploy. Now, some of what we should be doing certainly is, if there's evidence that something's working, put resources into that and scale it up and do those kinds of things. But we know that there are some of these intractable problems that society faces that does need new ideas to be engaged in it. And so one of the big challenges is, how do you finance that work? Right, you could have a very forward-thinking kind of government agency or a philanthropist who has resources to kind of just invest and grant out. But the idea of the pay for success is, well, maybe we can share risk, return, all in new ways that actually philanthropy and the nonprofit sector and the public sector haven't done before. And it's still emerging as a tool to see, could this catalyze new resources for new ideas? And the answer to that question is forthcoming. But your question is a great one, because it does address this issue of risk and what do we ever do to address these complex problems.
Good evening, ladies. So my question is, one, with working with the developers, how do you engage the developer, or how do you select the developers to work with? So it's one question. The other question is, do you prefer to see integrated residence versus 100% permanent supportive housing? And the third question is, are you involved in the design early on, like with trauma-informed design when it comes to developing the housing? And my name is Denise. I'm with Innovative Housing Opportunities, an affordable housing developer. Thank you.
I will just say, when we launched the Housing for Health program, this is just the team I was a part of before I joined ODR, boy, oh boy, when we launched the program, we spent a lot of time doing everything we could to get in front of developers to try to tell them we are the new kids on the block, but we're here and we want to be a major player in this work. We are interested in funding supportive housing. So our strategy was to talk to any developer who would be willing to sit down with us. Because we knew we had really ambitious goals. So our departments has a goal of providing housing to 10,000 individuals, and that meant we needed to talk to anyone who could deliver quality affordable housing. And I think your second question was about integrated services. So yeah, absolutely. We work with a variety of provider partners. Sometimes our developer partners actually have their own case management programs that they run, and then sometimes they bring in outside entities. And we try as best as possible to be involved in deals from the get-go. But there have been times when we have gotten a call from a developer and they say, my funding just fell through, or sequestration happened and we don't have rental subsidy funding. And we were like, we're there. we need that housing. We will cover the rental subsidy to be able to ensure that these units will still be affordable and available to people who are homeless.
So one of the things that the flexible housing subsidy pool did was provided another source of capital and a funding commitment for the housing subsidy piece. And there's someone on Corrin's team that actually goes out and meets with developers and has that conversation. And I know that the first couple of developers that wanted to use there was a lot of negotiating that was done to try to figure out what kind of commitment DHS could make to help the banks want to put lend onto the projects. And so a lot of that's been ironed out now, which is to the benefit of the developers who are now interested in that kind of partnership. So,
I spent a lot of time on the phone with bankers.
A period of my life a couple of years ago, just trying to say, no, LA County is not going to pull out our funding. No one in this county is in the business of making our most vulnerable homeless clients homeless again by pulling the rental subsidy. So I did a lot of, used my persuasive skills for a while.
But it's been a huge tool.
It's paid off though.
It's been a huge tool for the permissive housing developers in particular.
Yeah. Well, perhaps in just conclusion, we're here close to the end of our time. You've offered so many nuggets of advice and so forth, but what do you see as the promise of a model like this for either similar programs or other programs that you would actually kind of take away from your experience from inception to even now the launch, that you might share with those in the audience who might be interested in pursuing a pay for success model?
Yeah, I think what's so exciting about Pay for Success is that it allowed us to dream big and to really think about what we wanted to prioritize. And we didn't start with how are we going to pay for it. We started with what do we want to, whose lives do we want to change, and how can we most effectively change them. And then we dealt with the money later, and it worked.
Cool. I think I would say that it's sort of like I mentioned earlier, there's a lot, I guess from the philanthropic perspective, there's a lot of different ways to do performance-based contracting. There's a lot of different tools in the toolbox there. You could do grants and there's different kinds of loans. You can invest in a pay-for-success deal. I think it's really about the leverage and the opportunity for scale. What else can you bring to the table, and being open to the opportunity, that the fact that Pay for Success could be the way forward. I will say, which I think you could tell probably from Corrin and what we've told you so far in our faces, that it is a huge undertaking, definitely worth it if that's the way to get the project done. And I think if, as Corrin said before, if your aim is to do whatever it takes to serve these individuals who have a basic right to housing, and you want to enhance their lives, if you keep that as the driving force of the effort, then you'll reach your goal. But you've got to have that, because it can be a bumpy road. But I'm here if you want to talk about it. I'll be here.
And with that, please thank my colleagues for tremendous work in getting this done. And please view the Center for Social Innovation as a resource as you're thinking about these kinds of projects. And when we don't have the answers, we will do our best to connect you to people who do. And there's, like I said, everyone who has been in the room have their hands in different elements of how to make these kinds of innovations a reality. So again, I appreciate everyone being part of the evening tonight, and we look forward to the next time we get a chance to meet together. Thank you.